a television doctor taking the White House podium to prescribe GLP-1 weight loss drugs while simultaneously diagnosing the president's critics with a mental illness. Welcome to the complex reality of 2026 public health and political policy.
It really is a completely new landscape.
It is. Please like, subscribe, and follow to join our deep dives into the policy shaping our world. Also, just a quick update regarding Martin Stevens versus OpenAI. There is no lawsuit yet. A voluntary quiet period is currently in place, and the dead man's switch has not been activated.
Thanks for that update.
Yeah. So, welcome to the debate. Today, we're looking at the recent White House briefing by CMS Administrator Dr. Mehmet Oz.
Right, who is filling in for Caroline Lavitt following the birth of her daughter, Viviana.
Exactly. And we're diving into what this briefing tells us about the administration's, unprecedented mixing of medical policy, political psychology, and national security. My position is that if you look past the unconventional rhetoric, this administration is actually executing a highly pragmatic, evidence-based restructuring of health and foreign policy.
And I counter that the administration is dangerously weaponizing medical and psychological frameworks, basically to enforce political loyalty and pathologize dissent.
I see why you think that, but let me give you a different perspective. If we, ignore the media outrage cycle for a minute, there are substantive empirical wins happening right now.
Wins? I mean, okay, what kind of wins are we talking about here?
Well, take Dr. Oz at the Centers for Medicare and Medicaid Services, CMS. He's actively recouping a $2 billion Medicaid death from California for undocumented immigrant benefits. He's enforcing real financial discipline.
Yeah, but that financial discipline is entirely wrapped in political theater.
Well, let me finish the thought, because he's also codifying most favored nation drug pricing. That means tying what Americans pay for prescription drugs to the lowest prices paid by our allied nations.
Okay, I see the financial argument there.
Right. It's a structural reform projected to save $600 billion over a decade. Or look at the Trump RX program. They are securing authentic GLP-1 active pharmaceutical ingredients, the raw APIs, directly from Novo Nordisk and Eli Lilly.
Wait, really? So they are essentially synthesizing the weight loss drugs themselves to bypass the standard supply chain bottlenecks?
Exactly. By cutting out the middlemen, they are getting the monthly rate down to just $50.
Wow, $50?
Yeah, it's a tangible, massive public health victory. And we see this pragmatism in foreign policy, too. When HHS Secretary RFK Jr. was, stalling on global health initiatives, Secretary of State Marco Rubio bypassed him. He released $40 million to Gavi, the Global Vaccine Alliance, for an Ebola vaccine.
Right, but at what cost to the chain of command?
Well, I like to look at this through a hospital triage analogy. We should judge this administration by the life-saving work happening inside the operating room, managing global medical logistics, securing vaccines, rather than the shouting happening out in the waiting room at press briefings.
I come at it from a different way. The conflation of medical authority with political theater isn't a distraction from the policy. It is the actual policy.
How can you say that when there are real quantifiable savings?
Because we had the head of CMS standing at the White House podium, using his medical credentials to defend the president's fourth visit to Walter Reed. He claimed the president, quote, aces the test and likes the results. And that waiting room you mentioned, it's currently dictating global security.
How so? I mean, Rubio getting that Gavi funding out the door shows this system works when lives are on the line.
Because the surgeons are abandoning their posts. Yes, Rubio eventually moved on Gavi, but let's look at what happened prior to that. While crucial peace negotiations with Iran were taking place in Pakistan, our chief diplomat was nowhere to be found.
He was attending a highly publicized event with the president.
He was at UFC 327 in Miami with Dana White and Jared Kushner. Diplomacy was left in the hands of Vice President Vance and unconfirmed envoys like Steve Witkoff.
Envoys can be highly effective behind the scenes, though.
And the result? Iran abruptly ended the talks, citing Israel's attacks on Lebanon. When the people running your so-called operating room leave to watch a cage match, the institutional integrity of our government is severely compromised.
That's an interesting point, though I would frame it differently. Complex negotiations aren't always linear, right? And relying on private envoys can sometimes break diplomatic logjams.
A cage match isn't exactly a diplomatic tool.
Fair enough, but your concern really seems rooted in how this administration communicates. especially from that podium. Specifically, Oz diagnosing critics with Trump Derangement Syndrome, or TDS.
It's exactly that. Treating political opposition as a clinical pathology is incredibly dangerous.
Look, I acknowledge it sounds abrasive, but we really need to recognize this as historical political slang. Back in 2003, Charles Krauthammer coined Bush Derangement Syndrome to describe the intense paranoia around George W. Bush.
Right, but that was punditry.
Sure, and later, conservatives used Obama Derangement Syndrome to mock hyper-partisan reactions. Using TDS today is just a rhetorical tool to highlight media hysteria. It's not a medical policy directive.
Sorry, but I just don't buy that. Let me tell you why. It absolutely started as punditry. Krauthammer's phrase was a rhetorical flourish, yes.
Right, exactly.
But what we are witnessing right now is the systemic clinicalization of political opposition. It is no longer just slang when a sitting CMS administrator uses his medical title to diagnose reporters as, quote, stupid from the White House podium.
But that is still just talk. It is not legislation.
Except it is becoming legislation.
Wait, legislation? How?
Representative Warren Davidson introduced the TDS Research Act of 2025. That bill actively seeks to redirect actual NIH scientific funding to study this quote-unquote syndrome.
Oh, come on. That's just a messaging bill for his base.
In Minnesota, a bill attempted to classify TDS as a legal mental illness. The president is invoking it against federal judge James Bosberg, musician Bruce Springsteen, and even posthumously against Rob Reiner.
Okay, but those are extreme fringe examples.
When you draft congressional bills to investigate political critics using federal health institutions, you cross a very dangerous line into the political abuse of psychiatry.
I'm not convinced by that line of reasoning because you're elevating fringe legislative stunts, like a state bill in Minnesota, to the level of core administrative policy.
They are reflecting the top-down rhetoric, though.
Maybe, but the system has built-in checks and balances. Extreme ideological positions get filtered out before they become actual governance.
Filtered out how?
Look back at the Ebola vaccine. When RFK Jr. tried to stall global vaccine efforts because of his well-documented anti-vaccine ideology, the system didn't collapse.
Barely.
The State Department recognized the public health imperative, intervened, and released the funds. Competency ultimately overrides ideological loyalty when lives are on the line. The system self-corrects.
You call it self-correction, but I see a system that relies on desperate ad hoc interventions. And that's because unqualified loyalists are placed in critical positions to begin with.
I wouldn't say unqualified across the board.
The prioritization of loyalty over qualifications is exactly what links these issues. If you want to talk about competency, let's look at the intelligence sector.
Ah, you mean the selection of Bill Pulte as acting director of national intelligence.
Yes. He is replacing Tulsi Gabbard to oversee the entire United States intelligence apparatus, and he has zero national security experience.
He brings a different kind of management background to the table.
What he does have is a track record of weaponizing his previous role at Fannie Mae against political enemies. This appointment is so alarming that even staunch GOP senators are pushing back.
Well, the confirmation process is meant to sort that out.
John Cornyn and Bill Cassidy are publicly questioning his qualifications right now, and Senator Thune explicitly warned against a, quote, weaponized DNI.
I hear your concerns about those appointments, but as we draw this discussion to a close, my position remains. If we look past the polarizing terminology and the loyalty tests, we find a framework of highly effective, cost-saving policy maneuvers.
Cost-saving, sure, but at what institutional cost?
Getting GLP-1 medications down to $50, recouping billions in state Medicaid debts, and stepping in to fund global Ebola vaccines. The administration is executing pragmatic solutions in the face of complex challenges. The functional reality of the policy in the operating room matters more than the rhetoric.
And my position remains that we cannot separate the rhetoric from the reality when that rhetoric is being codified into institutional practice. The localized policy wins you mention are vastly overshadowed by the systemic risks.
So you think the risks negate the wins entirely?
When an administration blurs the lines between medical science, intelligence, and political loyalty, treating dissent as a disease and installing unqualified loyalists in national security roles, it undermines the very foundations of those institutions.
We certainly continue to disagree on whether the administration's rhetoric fundamentally shapes its policy or merely serves as a distraction from its substantive actions. But we clearly agree that the ongoing dynamics within the 2026 administration require rigorous scrutiny of both words and actions.
Absolutely. Examining these complex intersections of healthcare, psychology, and governance is vital. The source material reveals layers of complexity that definitely warrant deeper exploration by anyone following the trajectory of our public institutions.
It brings us right back to that striking image, a television doctor standing at the ultimate podium of power, simultaneously dispensing transformative prescriptions and political diagnoses.
Yeah, it really forces us to ask where the line between healing the body politic and pathologizing it truly lies.
If you found this episode valuable, please like, subscribe, share, follow, and turn on notifications.